Hello, folks. This is your host, Sharlee Dixon. Before we get started today, we would really like your help. Please rate and review our podcast with 5 stars and make sure to share it with a friend. By spreading the word, you help us grow and reach more people, allowing others to discover the valuable insights shared in each episode. Thank you so much for being an important part of the Behavioral Health Today community.
Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today. You're listening to BHT Bytes, our shorter, focused series where we are unpacking trending topics that are shaping the behavioral health landscape. I'm Peter Fenger, and I'm joined by Sharlee Dixon. Hi, Sharlee.
Hey, Peter. How you doing?
Hey, good to have you. Really excited about our conversation because today we're taking a close look at the alarming wave of federal funding cuts and what this means for mental health programs across the country. So I know this is a pretty big topic and there are a lot of heated opinions and it's really shrouded in confusing language. So I'm going to do my best to outline what I know and I can see as potential risks. But I want to be clear, the federal funding cuts are proposed and will actually need to pass with Congress before any actual loss of funding is enacted. So I'll start. Initiatives by the Department of Government Efficiency, also known as DOGE, under the Trump administration is planning on cutting federal funding affecting a wide range of programs. I'll get into those in a minute. The thinking behind this is that these cuts will roll back money that was originally intended for funding to combat the pandemic. So trying to roll back pre-pandemic levels of spending. And there's also a narrative saying that spending and staffing in healthcare is actually the cause of bad health outcomes. So the thinking is sort of that these cuts can shake the foundation and rebuild the healthcare system more efficiently. So the proposed plan is to cut funding partially aimed at funding provided by the American Rescue Act, or ARPA, and reduce $11 billion from the Centers of Disease Control and Prevention, CDC, and $1 billion from the Substance Abuse and Mental Health Services Administration, or SAMHSA. And then significant cuts of federal funding for public health and behavioral health services. The goal overall is to reduce $12 billion in federal spending. Now, while the vision of reducing unneeded sounds nice, it does. I want to list out the services that are potentially jeopardized. We're talking about mental health services and programs, specifically those through the American Rescue Plan Act, virtual therapy sessions, substance use and gambling recovery programs, public education, linkage to care for newly diagnosed individuals, surveillance of new cases, screening programs, HIV and testing care, vaccinations, respiratory monitoring. This impacts immunization contracts, impacts housing services. It'll impact perinatal screening and care, wastewater surveillance for infectious disease. This also goes to supporting veterans and military families, and the shortage of staff and layoffs will lead to long-term strain in our current health systems. So big picture, this jeopardizes mental health services, recovery programs, disease control, housing programs, and support staff to manage public safety and resource administration. Now, I'll take this time to step off my soapbox, and I want to ask you, Sharlee, when we look at what we're at risk of losing, who do you think this impacts the most, and what populations do you think will be affected?
Well, first of all, Peter, I think that these cuts are, for lack of a better word, ridiculous. I mean, they are impacting those of us that traditionally need the most help. While I understand that, funding is important and there are ways to reduce that funding, we are really putting those who are already at jeopardy into even worse precarious situations. If we have, low-income families that thrive and survive on food benefits, or their children need those free lunch programs or free breakfast programs at their schools, if those are being cut, or if people live in a rural community and they don't have the access to not just physical health care, but mental health care, things that the American Rescues Act worked to increase during the pandemic. If we lose those things, we're looking at full communities, full populations, and potentially even generations of horrible change and things that we've
Yes.
seen improve in recent years. And
Mhm.
so it is really horrible to hear. Like I don't have the best words to even say that, because I think it will be detrimental to just the future of not just those communities. Really, I think it'll be detrimental to the state of our country. We have started to build stronger communities,
Yes.
stronger connections between communities, and started to see ourselves as more of a united country. And when and if, preferably not, that these things happen, we're going to become even more disjointed, and I think more than they were before.
Yeah, no, you bring up a really good point. I do feel like the federal funding has really given us a chance to grow as a nation as we sort of address some of the health system needs. This is a very vulnerable population. You're talking about people that are in need of care, people that are currently ill and looking for a social system that will help them without falling through the cracks. I know that there have been a number of innovations that we've seen, sort of like the CCBHCs, improvements upon the health department. I would hate to see some of that progress that we've made in terms of like being able for folks to get access to some of those
Right.
things to fall away. And you're also talking about sort of increasing the equality. Right? Not only
Absolutely.
did this improve just health outcomes, but it also allowed access for a lot of people that may not have been able to given access. And so that there was a degree of equality that we were able to provide. So to see some of these funding programs get cut, it really is a risk toward some of the progress that we've made, and also just a risk of equality and poverty that we've had within the United States.
Absolutely. Absolutely. It's hard to even envision how negatively the impacts will be, because we had really started to see some change. Like you mentioned, we were
Yeah.
starting to see some progress in a lot of areas. And so I am really saddened to hear that that is where potentially we're headed.
Yeah, yeah. And so like we had mentioned, I'm talking about access, I'm talking about innovation
Right.
within the health system. But one of the things I didn't mention that the federal grants helped out with was really toward medical research and
Yeah.
public health and infrastructure. And I want to ask you, as we, sort of pivot the conversation, what impacts do you foresee as a result of some of these reduced research and development?
Absolutely. One of the things that I feel like America has prided themselves on is being able to innovate, being able to be on the front lines of research and figuring out cures for things and necessary treatments. And to have those cut, again, it really jeopardizes not just how things go for Americans. I do think it also jeopardizes how we're seen globally as well.
Yes.
So not only are you going to see, we may have impacts on reduction of research for diseases like cancer and diabetes, things that don't necessarily have just a quick give you meds type of cure or treatment for.
Right.
Our research has been used in countries worldwide. So not just will that impact be felt here in America, I think it has larger global impact, and negative changes everywhere.
Yeah, yeah, I agree. And in fact, sort of echo this. I saw a headline recently that said, in response to this, that the EU is actually putting $500 million to universities, within the European Union
Yeah.
for them to gather American research and scientists. And again, you sort of talked about how like America sort of prided ourselves on being innovators in these fields. It's a
Absolutely.
huge opportunity for global countries to take advantage of this. We've never really been in this situation before where we see our country sort of being taken advantage by other countries. And
Absolutely.
unfortunately, this sort of exposes us and makes us a little bit more vulnerable.
Mhm.
We also talk about how this reduces emergency preparedness efforts, increases risk for outbreak. We're already
Yeah.
talking about seeing some headlines right now about a new strain of COVID that might
Mm.
be maybe not as strong, but it is more contagious. So,
Wow.
the risks from COVID aren't quite over,
Right. Yes.
but,
Yeah.
it's easy for us to sort of forget about it, right?
Right, right. And then what happens, I mean, and I don't want to say that another pandemic is coming, but I mean, it would be naive to believe that there isn't some other like super sickness somewhere else that may come here without the level of research that we had during COVID to, do the detection, to do the testing, to do, just the mass sending out of tests or, quick creation of an effective vaccine. If we don't have those things, like what happens to us?
Yeah. Yeah. Yes. Yeah. And again, I don't want to be too alarmist.
Yeah,
I
yeah.
know we are, sort of projecting into the future some of our
Hmm.
fears, but
Yeah.
I think that the risks are there. I want to park here for a little bit. And I want to say that the administration is trying to build momentum for folks to take control of their own health. I know on the show, I remember Graham advocating that we have to control our own health. And I want to sort of take this landscape, the changing landscape that we see in healthcare, and I want to ask you, who is the role model that people are going to look at to sort of navigate their life? When we sort of see some of our social security systems, these nets that we have, who do we go to now to sort of navigate this change in healthcare? Who do you sort of see as role models for this?
That's a very interesting question, especially because we're speaking originally about how a lot of this is about innovation and new
Mhm.
access. So who can be our role models if we are the ones that are like, okay, well, we're doing things better and differently than the generation before us,
Right.
who really then can be our role model?
Yeah.
Especially we mentioned this already, but discussing folks that live in rural communities, like who is going to be your role model if what you relied on just a few years ago is no longer there. Not to be completely doom and gloom, that does also give access or allow for folks to be more of an advocate for themselves, to maybe even use this as an opportunity to develop some things community wide, just in their own community, or the opportunity to come together and do some things for ourselves. So I guess I can say that is a positive that could potentially come out of this, is that we don't necessarily look back at any one specific role model, but use
Sure.
some levels of social change to work together to create better good in our own communities by ourselves, for ourselves.
Yeah, no, I think you're highlighting. I do think that the response will really come from a community level. I spent this last weekend and they had a wonderful fair, sort of like a festival. And at there, I did notice that they had a section just for public health, right? People could go in there and make an appointment for mental health, or they could go in there and could get vaccinations. I see sort of local community being the response to some of this, where, we might not see maybe a federal level,
Hmm.
outreach of some of these things, public education, et cetera. I do see more of the response coming from a more local community. So again, all
I agree.
parents, healthcare professionals, our community, I think these are the people that'll sort of look toward how do we navigate this new healthcare. I think as a parent, your role is really trying to understand your own advocacy for your health and
Mm-hmm.
trying to display that to your children.
Yeah.
I don't know. I guess growing up in my own household, I don't think that my parents really felt the need to advocate for their health. Like I felt like the system was sort of in place and they had access to the right doctors. They had a lot of good information from insurance. I sort of saw as I got older that their navigation, once they started getting older and more sick, that it became harder for them to find that education. And
Hmm.
I think that it was sort of like a lesson to myself that, we kind of have to do like the work ourselves. Yeah. So anyway, what I'm really trying to say is, given the experience of changing landscape, I really do look toward parents to kind of navigate what this will look like for their children. And I do think that the response will come from a community level.
We'll be right back after word from our sponsor.
Are you preparing for a licensure exam in psychology, social work, marriage and family therapy, counseling, or behavioral analysis? AATBS is here to help. We have been supporting behavioral and mental health students to prepare for their licensure exams for more than 45 years, working with over 1 million students to succeed on test day and move on to the next step in their career. With products ranging from comprehensive courses to quiz banks and delivered live online, self-study online, and in print, AATBS has test prep solutions that meet every student's needs and learning styles. Visit us today at AATBS.com. That's AATBS.com. And use promo code BHT15 to save 15% off your next purchase.
Completely agree with you. And in my situation growing up, I'm from a bit more of a rural community. But again, my parents, like yours, were fairly healthy. But the good thing about where I lived, it was about 45 minutes to an hour south of Charlotte. And so really close, or not really, but close enough to a bigger city. So what we did not have in our smaller community, we could get there. So my family was really blessed and to be able to, we had a car, reliable transportation to get us to the next city. And so when there were health concerns or, mental health concerns, even whatever we needed, we were able to access it because we were close enough to be able to do that. So again, I think community and being able to advocate for what you know that you need. And if you aren't able to find those answers right by you, being able to be courageous enough to step outside of your comfort zone and go look for it.
Yeah. And I'll also want to sort of highlight another group. I think that veteran healthcare is also going to be a big voice for some of this advocacy as well. Like our veterans deserve the care. Like they are the ones that sacrifice a lot. And I think that when it comes to benefits and when it comes to care, I think that they can be a really good example and a good spotlight for the rest of the nation as well.
I completely agree with you. And it's heartbreaking sometimes to hear the stories about the veterans. I work with veterans. I have quite a few that come through my dialysis clinic and they're kind of scared about not that it was never necessarily easy to get healthcare, but things did improve. And then now they're really scared about what that will look like for them. And so I've been hearing a lot more conversations amongst the veterans themselves about what they can do, how they can voice their concerns, who they need to write up at Congress and who their representatives are. So it really is giving them an opportunity to advocate for themselves in a different way. And so while they fought for our safety and our country, they are now fighting for themselves, which it's really empowering to see.
Yeah, it is. And I think one of the details that you're highlighting is I think that these sort of issues kind of reflect a responsibility of how can we as citizens sort of voice our own. And it really gives us a chance to really understand what some of those levers are. I think that, historically we've had a lot of political leaders sort of act in our best interest. And I think the landscape has changed a little bit to where it feels like some people might have their own personal agenda.
Yes. Yeah. And it gives way to more of social change. Not to say that in America hasn't been done. I think though that we had kind of started to rely on Washington to make those choices, like you said, in our best interest. And I am seeing a resurgence of social change and people starting to advocate more for ourselves and what we as a people need, and not allowing those, that 1% to make all the choices for us.
Yeah. It's starting from a grassroots level. So I mentioned before that this policy still needs to be approved by Congress. I know you and I were talking a little bit before. You were mentioning that some of this has been approved, others have not. So what I'm really expecting is there to be further debate on what services will be reduced and its implementation. But if we could just put on our revision hats, how could we rebuild a more resilient mental health infrastructure that can withstand political and funding volatility?
The first thing that came to mind when I heard let's put on our envision hats, there was actually a group that I spoke with in a podcast maybe a couple of episodes ago. This will air, and it was Evolved MD. And it was really interesting to me because they were able to kind of merge primary care with behavioral health care. And they had everyone in one building. And so you could go from, hey, I'm having this issue with my body, this physical health issue, but I'm also kind of having some behavioral health issues too, and you're able to see a behavioral health care provider right there on site. And you walk down the hallway and here is your person to see. You're able to be followed both medically for physical health care as well as behavioral health care. And I really think that that's honestly where I see us, or we're in the perfect world where we will go to make sure that the whole body is being cared for. Because with social determinants of health, so you're not really able to focus on all of your other health problems until just your life is together. And so I really think that as we envision a future of what we would want in a perfect world, that is definitely one of them. That just that integrated care model that I've seen starting to come in some parts of the country.
I really think that there's some innovation within the private sector that can drive some of the decisions that can help lower the risk.
Absolutely.
For funding cuts like this. We had a really good conversation with City Block and some of the ways that they were able to use data in order to identify potential risks or people that might be highest for illnesses. I think that you might be able to look through the same lens and maybe create a database and identify certain areas. We're talking about loss of funding for low income or rural areas. That might be a perfect formula in order to say, like, well, this is a high risk area. Maybe we need to just keep, some of the funds in this area. I also think that, if we had strong data, we can create emergency preparedness protocols. So whereas the money is removed in order to get back to, pre-pandemic levels, we might have protocol established that in the event that something happens, ABC happens. So where the money might not be here now, in the event of an emergency, the money will come. And there's a little less of a risk knowing that, you talk about disease and outbreak, we have some systems in place that can combat something like that.
Absolutely. And I completely agree that I do feel like, especially in the beginning, a lot of things that happened with COVID seemed to be more of a reaction. And there didn't seem to be like this proactive step in place to say, okay, if A happens, then X is what we need to do on the other side of it. So I completely agree that in the wake of financial funding being cut, then you're able to just kind of streamline those processes. So if something happens, you already know what to do, and we're not waiting until it's already happened to us to make a plan going forward.
Yeah.
Yeah.
Yeah, I think some of the unclear language, even just the lack of preparedness, I think without more detail, this looks like a senseless sweep of change. But I think it's partly just due to the political system that we have. Right now, the current administration has 4 years, a 4-year timeline in order to pass. And some of these changes are done with the same sort of broad strokes that we've seen in other things like ICE and people being misidentified as immigrants, and those currently unemployed as federal employees, despite being very skilled workers. There's just not somebody going through there with a fine-tooth comb and retaining really the important programs that are aiding our communities. And some of the points that we're making is really trying to ask for that. We're trying to get those details. Instead of a mass elimination of services that affects large vulnerable populations, we can have a little bit more reassurance that, those details are being taken care of. So I want to highlight that there's already momentum being built against this policy. States have already filed lawsuits and there is public outcry. But there's a need for unified messaging from health coalitions and providers. We need to be leveraging data. I'm talking about behavioral health integrations that improves outcomes and saves money, and advocacy at both federal and local levels in order to restore emergency funds. And if you feel strongly about the impact of your own communities, I urge our listeners to take action and contact your representative. Mental health services aren't a luxury, they're the foundation of public health. These cuts don't reduce access, they dismantle safety nets for millions. Now is the time to pay attention and push for sustainable support. Thank you very much for listening to BHT Bytes, and we'll catch you next time.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.